I am taking an opportunity to make an awareness regarding stroke, including its prevention and early management. So, what is stroke? Stroke is a neurological deficit which is occurring suddenly after a vascular insult. It can be of two types, ischemic or hemorrhagic. The ischemic stroke contributes around 85% of total stroke and 15% is contributed by a hemorrhagic stroke. So today's topic of interest will be ischemic stroke. As we go by the numbers, around 15 millions of people affected by stroke every year globally, and it is the second most common cause of death in population of above 60 years of age whole worldwide. So it is very important to identify a stroke and make a treatment as soon as possible. So how to identify stroke? To identify stroke, we have a simple mnemonic which is B fast, in which B means balance, E means eye, F means face, A means arm, S means speech, and T means time. If any of above difficulty occurring suddenly, it is a sign of stroke and we should visit a hospital as soon as possible if any of above signs occurs. Coming on the risk factors can be divided into modifiable and non-modifiable. The modifiable risk factors includes hypertension, diabetes, heart disease, abnormal cholesterol levels, smoking, alcohol intake or sedentary lifestyle, taking OC pills. By knowing these modifiable risk factors, we can modify these risk factors and prevent stroke in future. There are also non-modifiable risk factors for stroke, which includes age, gender, the race and the genetic factor of family history, which is not preventable. So I am going to speak about few lines of what is stroke. A stroke happens when there is a dislodgement of clot or thrombus from major arteries or heart towards the cerebral artery, which indeed causes the occlusion of cerebral or brain blood vessels, which causes the ischemia or the deprivation of blood supply to that part of brain, which indeed causes death of that part which is supplied by the artery, and finally stroke happens. This point is important to understand the management of stroke. As we know, if brain ischemia occurs, it is an irreversible process and we can't do anything after the ischemia has happened. So there is a concept of penumbra, which means a reversible injury of brain which can be prevented by revascularization of that artery. So to do so, we have a golden period of 3 to 4.5 hours. If patient received in the hospital within this period of time, we can offer him IV thrombolysis via agent known as recombinant TPA, and if we offer this treatment, it is mostly beneficial for the patient and it prevents some amount of disability in future. Once this period has been crossed, we have few more options of revascularization, including mechanical thrombectomy up to the period of 24 hours. But beyond 24 hours, we don't have any of the intervention for the stroke, and the treatment will only be the management of risk factors and rehabilitation of the patient. So it is very important to identify risk factors for stroke, identify a stroke and make early call to the hospital if stroke happens.